Health communities. It helps Fred and Leah, small businesses, seniors, young adults, PICOSAR, Ken McCollier, United States of America. So, I mean, it really is one of those things, like, if we can begin to talk on that level, I mean, not just, oh, it's going to help America, but we can talk to our family members and our families and community members and say, this helps you. One of the big ones that I think is an easy selling point, because who doesn't want to help the children, and I put some of these around the corner, and this is again just an easy read with a couple talking points that gets a little bit more in depth, so if you want to, all this stuff is out there. But Bert, I'll have you read one of them. Pick one of those off for us and just read how it helps children.
Okay. More pediatric providers where kids need them. Expands the healthcare workforce, including pediatricians, pediatric nurse practitioners, specialists in pediatrics, and pediatric oral health professionals to ensure that children will have access to high-quality health care. This year requires that parents enrolled in new plans be allowed to select their child's pediatrician from among any participating providers.
So again, I mean, and again, what I have just bulleted up here is just really stuff that we can combat just that anti-healthcare rhetoric with, is, you know, stuff like Bert was saying, or, you know, it's going to look at the pre-existing coverage for children. You know, taking out those lifetime caps. Then I like these pictures too, because it also helps speak to, you know, the fact what Michelle Obama's doing with the Move America, is truly getting people to, this goes back to that obesity in our cake, is you know, making sure that we are looking at our diets and how we eat and how we're bringing our communities up too with our children. So healthcare reform for seniors. Who has that sheet?
Thank you.
Tom, why don't you read us one of those bulleted points, please?
Lower costs for America's seniors. Thousands in savings by closing the Medicare donut hole. More than 8 million seniors in 2007 hit the donut hole, which is the gap in prescription drug coverage in Medicare Part D. This year provides a $250 rebate to Medicare beneficiaries who hit the donut hole in 2010. Beginning in 2011, the Act institutes a 50% discount on brand name drugs in the donut hole, and the Act will completely close the donut hole for all prescription drugs by 2020.
Wow.
Yeah, so
that is impressive.
That's fantastic.
And RC, that's great too, because you strike me as someone who's in the know, and you're one of these people that are saying, wow. I mean, it is. Yeah, it's about getting this information out, because I didn't know. Yeah, I knew the donut hole stuff because I heard it, but I didn't know it.
But I don't know what the donut hole is. You don't know what the donut hole is?
No. Bart, tell her what the donut.
Tell her what that donut hole is.
That was knowledge, right?
I don't know the specific numbers, but when you're on Medicare, they Medicare will supply some reimbursement for your prescriptions until you hit a certain level. I think it may be $2,500, and then they pay and then they pay nothing, and until you get to like $3,500. So there's this gap, and they did it to ration federal dollars going into the program by just pulling out a whole benefit that they didn't cover anymore. It made absolutely no sense to anyone. So most people hit it, they didn't know it was there, and all of a sudden they're having to pay out of pocket totally for all their prescriptions. So it was a dumb idea to begin with, and the remedy is they're going to start giving rebates to people, $250 when they're in that donut hole, and that happens automatically. People don't have to ask for them. And then this year, all the brand name drugs are going to be sold at 50% of their, you get a 50% discount when you're in the donut hole on brand name drugs, because generics are already pretty cheap. So that was the deal they made with the pharmaceutical companies, was that they would sell at 50% until you get back to the other end of the donut hole where they start, you know, paying subsidies again for your prescription. So, and then over the next, was it 2020 when it closes? It'll slowly close. The donut hole will slowly just go away. But it was a big negotiation with pharmaceutical companies. Is that a good enough description?
Excellent. And I like this picture of Reform for Seniors because you see Indies in that one, so hopefully he's continuing to work for the seniors here in Lancaster.
We might need to mention him, although he gets benefits that other folks don't.
Yeah. Small business benefits. And I got these pictures on there because this is an event we did just last week in Laramie talking about the benefits to small businesses with the Affordable Care Act, along with the 17 other tax cuts and credits the Obama administration has passed down. But a really engaged crew, and again, there's a lot out there, and I don't claim to be, well, I'm not an expert on it, but we brought in this guy, his name's Jason Raisler, he's a CPA, and he was able to talk to so many other aspects of these acts and how they truly are benefiting our small community members as far as, the businesses and their employees too, because a lot of these people sitting around had anywhere from 2 to 5 employees was all, and they were unaware of some of these tax credits, tax cuts too. So, there are these benefits to small businesses that, we need to be discussing and talking about. Who has the small business sheet, if they want to read one off of there?
There's one here. 13,800 small businesses in Wyoming could be helped by a new small business tax credit. It makes it easier for businesses to provide coverage to their workers and make premiums more affordable. Small businesses pay on average 18% more than large businesses for the same coverage, and health insurance premiums have gone up 3 times faster than wages in the past 10 years. This tax credit is just the first step towards bringing those costs down, making coverage affordable for small businesses.
And again, talking points when we did these small business canvases, and I would talk to those individuals that would look at me with their arms crossed saying, well, I got a problem with the Obama administration, to be able to say, if I can just have a minute of your time and say, something like to that effect. Are you aware that, pay increases have went up X, but insurances went up Y, and how does that balance out for you as a small business owner? One guy in particular still just stood there the whole time and didn't want to hear anything. But all of a sudden, you could tell, and some people we were talking to, the wheels kind of started to turn, and I'm like, well, maybe this isn't so bad. Do we know what March is? It is Wyoming's History Month. It's also Wyoming's Health Month. And it's also a month with St. Patty's Day in it.
But you go back and it's women, not Wyoming. Women?
You've got such trouble with W words.
Women's History Month and Women's Health Month.
So I never majored in English.
Or spelling either.
Marcy. If it wasn't your office, I'd kick you out of here. All right, but there has been health reform for women's here in the state of Wyoming.
Women, just women.
Women.
So, and this is one of the biggest ones that we can talk about is, you as women have what's called the hidden tax on American families. It's something that just for being women, in many cases, you're going to pay more for your premiums, pay more for your insurance than any one of us men knowing will.
Why is that?
And there's water down there already.
Women are considered to have pre-existing conditions because they can have children.
Is that a mental thing that, they're...
Okay, Jack.
So, who has the sheet on women?
It better be Jack.
I don't. That's just causing trouble.
Who has the sheet on women?
You screwed it up again, Brian.
We don't have a woman.
Let's see.
Oh, right here, this one.
There's a search here.
This one?
Yep, so if you want to read us just one of those bullet points, please.
Just one.
Yep.
Insurance industry reforms that save women money. This year eliminating all lifetime limits on how much insurance companies cover if women get sick, and it bans insurance companies from dropping women from coverage when they get sick. The Act also restricts the use of annual limits in all new plans and existing employer plans this year until 2014, when all annual limits for these plans are prohibited.
So what's that year when they get prohibited?
2014.
2014.
And this thing says they charge 1.5 times as much as men.
And we can't leave out, the young adults. And I say young adults too, because we did a around House Bill 74 on campus a couple weeks ago at the UW campus. And this is a gal who's currently an intern. Her name's Emma for Organizing for America. You know, and this is one of those, like, glorious, passionate young women who is definitely, and she understands that too, that she's going to benefit from this health care too. But she's one of those individuals who hopefully is going to help carry that message and going to go on to do creative things and take chances in her life because this legislation was passed. You know, and there's a picture of Obama meeting with young people too, just to continue to discuss that dialogue. And again, this just illustrates too that, you know, our president, this legislation, I mean, it's all encompassing. It works on so many levels if we allow it to. So, you know, whether, you know, we all have women in our lives, whether it's our moms, our sisters, our spouses, our partners, our daughters, our neighbors, we can talk to that. We probably know some young adults, or at one point we were, and we have to think about maybe I took a job that I didn't want to take just because of health care. We all know some seniors. We all know small businesses. Hopefully we frequent those here in Casper, and, you know, we need to continue to do that. So, information that's out there. What about lifetime limits? What about preventative care, wellness programs? What are the specific benefits of the Affordable Care Act implementation? I don't know what this term means. Is there a glossary? I wish this was like Orbitz.com. Is there pricing options? What about pre-existing conditions? All these questions come up. And actually, I got a lot of these questions myself answered today due to the work that Barb did in bringing up some HHS gals here and the work that they're doing through CAP. Because, I mean, these are big questions, and a lot of this stuff I don't understand, but please write this website down, because this is absolutely amazing. This is healthcare.gov, and just let me show you.
And I'll put it on this little link so we can use it.
Thank you, Bree. So you get on this website, it starts like this. As you see, it's going to talk about whether it's families and children, individuals, people with disabilities, seniors. We also have all these options along the top, whether it's finding insurance options, and this works on so many levels. And again, we could spend, as the gals today did, almost an hour just looking at this. So you can basically, you know, find out the information that you need to know. And this is another one of those that people are long-winded and want to argue with me about what healthcare does for them. This is a simple site, healthcare.gov. I think, you know, most people could probably remember that. If they need to, I can write that on a Post-it note, give it to them, and say, just check it out for yourself. And if you got on this and you couldn't find your answers, then you probably weren't searching long enough, too. Because there really is. You can type in any question you have about healthcare. I want to look up, you know, mental health. There's something in there in regards to that. And it's just, I mean, it just provides so many links to so many different, whether it's press releases, whether it's, as we talked about earlier, one of my favorite attributes of this website is the timeline. If I can find it. So if you go to Understanding the Law, timelines and when it changes, and hopefully you can all see this, but you got 2010 all the way up to 2015, you can keep scrolling over, but for instance, 2011, the prescription discount drugs, when we talked about that earlier, I mean, it's talking about that 50% off the brand name drugs today for seniors. So I mean, you know, this is an excellent resource, and it's one that we truly could spend all night on too. So as you can see, this timeline is broken up to what's happening periodically throughout that year, and it's truly something fantastic, as it helps us, whether it's establishing the health insurance exchange, which is something I hope our state is looking at and continuing to grow upon, and that's work that Barbara is doing and a couple other folks, so hopefully that continues. But again, this is such a broad website that please spend some time on it, and let your family members know about it too, because it really is something we can spend all night on if we really want it.
Can I give the caveat I gave today?
Please.
On this website, they have a place where you can go and look for insurance options in Wyoming, insurance and pricing options. And it's very misleading in my mind, because there's not every insurance company has submitted information to healthcare.gov, so it's really just the bottom feeders. So even though it looks like you're shopping, because the full force of the law hasn't been implemented yet, and we actually have, in 2014, we'll have some value precautions put on every plan. They're not there yet. So they're really low value plans. So it looks like you're shopping, but the products are not good products. So
Low value means crappy.
Is there any way we can get them to put a caveat that, like, not all insurance available in Wyoming is listed on the site?
we should ask for something. We have had a discussion because I said it looks like shopping, but it's not shopping. And their point is it's promoting transparency. So they think consumers should be savvy enough to go, oh, I don't want a $10,000 out of pocket with no, you know, it doesn't cover this, it doesn't cover that. So it's starting to show what an exchange will look like, that the categories are there, but there's no real comparison for a good plan. So.
Well, and Barb, I think you mentioned it earlier too, like Blue Cross Blue Shield's not even on there yet, are they?
They withheld because they thought that the government was trying to co-opt their products and that they would instantly be in an exchange without giving permission, so they have just been really leery of sharing information. And like a self-insured plan, like the state wouldn't be on there, so you can't compare to the product that the government workers get, and so it's really, it's a little weird.
But again, I like that point, Barb, because again, when we're talking with individuals about this, the insurance companies don't have our best interests in mind. Or they would be like, wow, this is an opportunity for me to gain more clients, so I'll put that information out there. So when people want to argue about the benefits of healthcare, that's just one of those great examples of, well, here's this website that's basically, and the gal today, who here's been on like Orbitz.com or Travelocity when you're shopping for airfare or car rentals, and it's such a great way to get things hopefully at a cheaper price, and they're not even engaging in that process either. So that to me makes me scratch my head and go, well, they probably aren't looking out for Brian Lee then.
The goal of the exchange is good. It will be good in 2014, but only if the insurance regulations get put in place.
So the goal of the exchange is like an Orbitz or...
To make shopping easier, but that is just the tip of the iceberg. The goal of the exchange is to be able to regulate all the products that are in the exchange and say you have to be a certain level before you can sell in the exchange. So we're probably going to be on the low end of regulation, but like Massachusetts uses it to control price. And we have this kind of myth in our mind that the more competition we have out there, the better prices will be. No, we're just bringing the bottom feeders to Wyoming, and we have crappy products.
Can I ask her just another question?
Please.
Why are we bringing the bottom feeders to Wyoming?
Because somebody thought that if we removed regulation from insurance products, we would get more competition and it would drive down prices. But we don't have any regulations to provide value and protection for the customer, so we get these crappy products.
So our legislature.
Charlie Scott did it in the 70s. But it was years ago.
Right.
Yeah.
And it did indeed bring in competition, but it's, you wouldn't want that product.
And at the same time that the state insurance commissioner has no power to tell these people. It's not like they're a Better Business Bureau or anything. They can basically sympathize, but they can't order them to pay. You know,
so that's an issue we need to take up at another time.
It's a big issue.
And has to do with
ages.
So
but actually, the state exchange theoretically should
solve
strengthen
that
the situation.
That'll be another regulatory body, and the states have to figure out how they're going to.
And if the state doesn't want to do its own,
So you mean it might bring that problem out?
Yes. It'll have to be transparent.
It'll have to be.
It'll have to be, and they'll have to meet certain levels.
So people will be able to see it.
Hopefully.